Welcome to Team Gut Girls, the podcast for anyone who's ever unbuttoned their jeans at 10 a.m., mapped out every public washroom in a 10-kilometer radius, or wondered why one bite of food can ruin an entire day. We talk about bloating, constipation, diarrhea, reflux, nausea, abdominal pain, histamine chaos, and all the quiet gut symptoms you're told to just live with. Join naturopathic doctors Dr. Whitney Baxter, Dr. Christina Carew, and Dr. Dominique Vanier. Your gut is talking, and we're here to help you translate. You're with Team Gut Girls now. Let's dig in.
And before we dive in, just a quick note. This podcast is for educational and informational purposes only. It's not meant for medical advice and doesn't replace working with your own healthcare provider. We're sharing general information, not diagnosing or treating anyone. Please always talk with your physician or licensed healthcare practitioner prior to making changes to your health, medications, or supplements.
If you spent any time on Instagram lately, you've probably seen someone talking about cortisol belly, hormone belly, that mysterious bloat that seems to appear overnight in your 40s. One reel may tell you to stop eating, another one says it's gluten, another one says you need a cortisol supplement or some kind of digestive bloating support or super belly. So what's actually happening is what we're going to talk about today.
And so many times my patients come in and tell me, it feels like I woke up overnight and everything changed. I haven't changed my diet, my exercise routine, but when I wake up in the morning, my stomach is flat, I feel good, but by the end of the day, I look 6 months pregnant. We're asking, did my gut just stop working or what has happened?
Yeah. And social media, I feel like, has an answer for pretty much everything. So we'll see a lot of terms thrown around like cortisol. This may be parasites. This is, estrogen dominance. And I feel like it can be quite confusing for the general public.
So today we're going to focus on perimenopause, separating what's trending from what's actually supported by physiology and help you to understand a little bit more about why is bloating in perimenopause more common.
So we have a new recurring segment now going forward, and that is what's trending this week. So this week's reel says lowering cortisol fixes all bloating. Let's talk about that.
Yeah, so I've gotten this one in my feed as well. Stress certainly matters in all health conditions, not even just specific to bloating, but stress makes everything worse and also makes everything more accentuated. So stress does matter. But bloating in perimenopause isn't just only because of stress. Certainly, it's a time of more stress. Often women are finding themselves taking care of their parents and their kids and also still working. But things like hormones and gut motility and microbiome and histamine and sleep and stress all kind of contribute. And so it's a bit of like a snowball effect where, all these things have accumulated and lots of times we're able to accommodate one thing, over a period of time. But now things are starting to all sort of accumulate all at once.
All right, let's shift back into our myth-busting segment. So I'll start off here with something I think is so common. People hear about, talk about all the time, that this bloating is just a cortisol belly.
Yeah. So I think yes and no, right? So there is cortisol's influence on things like digestion. And so when we are in fight and flight, we're not resting and digesting. And I often explain this to patients as though they were animals hibernating for winter. So when an animal is in fight and flight and just randomly trying to consume as much as it can before winter comes into place, we see them walking around and there's the raccoons, at least where I live, with the giant bellies. And we know that they're kind of storing for winter, and that's intentional. But our bodies are made in a similar way, even though we don't have a similar drought of access to food. And so if we are running in a fight flight, hopefully not hibernating for the winter, but just in general, then our digestion really does slow. It's rest and digest. And so if we're not able to do that, then we are accumulating more, and it's often in the abdominal area. But we also know that perimenopausal bloating is driven by things like estrogen which is more fluctuating. So we'll seem like there's more estrogen initially, although it might be the same amount you've always had, and then decreases over time. And part of that is because our progesterone, which is our second half of the menstrual cycle, which causes the, ability for the body to retain baby, but also when it declines, rises and falls, that gives us menstrual bleeding. And so over time, most women will find that their progesterone decreases first. I always say that this is like a reallocation. So the body's like, hey, now's not the time to have a baby. We could use this progesterone over here to fight this stress or to support your thyroid or other things that are going on. It's sort of like your body's natural mechanism to say, hey, now's not a good time to have a baby. But in that decline of progesterone, we see estrogen rising, which is part of what marks perimenopause for many women. But estrogen also affects things like gut motility and water retention and changes in visceral sensitivity. So, how much are we feeling and what is going on in our bodies? And so is cortisol belly a thing? It plays a significant role in how our body is changing and shaping, but that's something you can experience regardless of age based on, this sort of fight flight that a lot of people are finding themselves in these days because we're not really resting and digesting. And so our body's just sort of holding on for dear life. So I always think about it like it's providing you like a seatbelt, which is maybe not the seatbelt you want.
I like that analogy. It's also where we see the hormones, like you said, fluctuating significantly, right? So for example, when we're like testing estrogen 1 month, we may see a totally different number the next month. And so it's these swings that end up affecting people. Another myth we want to chat about is bloating during perimenopause is normal. You just have to live with it.
So you don't have to live with it. That's why we're here. That's why we're here to talk to you. And as Dr. Dominique said, like estrogen really spikes and crashes. So it's kind of like shifting all over the place. It's why one day you feel perfectly good and sane, and the next day you might feel a bit crazy. Estrogen, we know, affects gut motility, fluid retention. It's why people will often feel like PMS type bloating. Bile flow, histamine release. So estrogen drives more histamine. Progesterone tends to calm it down. We have less progesterone. We have more histamine. That visceral sensitivity. So just like the overwhelm of how we feel inside our abdominal area. And so if we're kind of having our gut slow down and swell and feels like it's overreacting, then we're going to feel like that bloating is more pronounced maybe than it is. But perimenopause can also create like almost like IBS symptoms. So it's a driver between the hormones, the immune, and the gut. And it's not really related to food. And so that's where we find all these people who come into my office and probably yours as well, where, they're looking for weight loss and when you get to the route of like, well, why do you think that you need to lose weight? Or, what do you hope to accomplish? It's like, I have this abdominal weight gain. I'm going through all these hot flashes, feel like I'm gaining weight. And all of this is like a bit of a mix of things that are going.
Yeah, let's maybe talk a little bit more about how estrogen specifically affects gut motility. And that the question really being like, is estrogen unbuffered? And so as it relates to higher estrogen, we know that can slow digestion, meaning food can sit longer, it can ferment more. And then anytime something is fermenting, we know that we're going to see more gas production. And so, when somebody says, I wake up fine, but look pregnant by 7 p.m., that type of pattern, that's a classic motility hormone mismatch, especially for someone in their 40s or 50s, like around that time when we're expecting to see perimenopause. And so how estrogen plays a role in bloating is as follows. So the first point being estrogen directly will slow gut motility. Estrogen, we know, influences the enteric nervous system, which is like your gut's second brain. And higher or fluctuating estrogen can slow gastric emptying. It can affect small bowel transit, so it can slow it. It can also reduce colonic movement. And so what that means is like food is just hanging out, and it's hanging out in places for longer where we don't want to see it hang out for longer.
And then we'll see this fermentation, like I mentioned, this gas production, and that typically leads to bloating. And so this is why estrogen-driven bloating often feels progressive over the day, particularly worse after meals, or like worse after a meal later in the day, or just generally worse later in the day. And then also sometimes feeling like an increased pressure rather than pain.
So it looks a lot kind of like SIBO, right? And so as consideration, when we're talking to women in this category, we need to also include the hormones as part of our consideration mix.
Yeah. So point number 2 of how estrogen leads to bloating is it increases water retention. So a lot of women will feel this, like I feel like I'm retaining water. They'll even verbalize that. Or the way I'll kind of talk through where it shows up or how it shows up, it might resonate with how it feels or looks in your body. So estrogen affects kind of fluid flow through the cells in our body and over the gut wall. So it's going to affect a hormone called aldosterone. So that's important for fluid and sodium balance. And then the next point, sodium balance. And then vascular permeability. So just the opening and closing of our vascular walls to allow fluid shifts throughout the tissues. And so usually we think about fluid retention in our ankles, swelling in our ankles, but it's not just here with estrogen. It can accumulate in the abdominal wall, the bowel lining, and the mesentery, which are the tissues that support the gut. So this is where you're going to feel that bloat and kind of getting worse throughout the day, like Dominique just mentioned. And this is why estrogen-related bloating can feel tight, puffy. So like in your hands, joints, you kind of feel it everywhere. And you feel like it's difficult to pass gas or even your bowel movements. So maybe you are having regular bowel movements, but it just feels incomplete, or you still feel that puffiness. And why it's difficult to link up anything with food or digestive solutions, like more laxatives, for example.
So the third way that estrogen can affect bloating is that it stimulates mast cells. And we have an episode earlier where you can learn more about mast cells at episode 9, and we'll link that in the show notes. But mast cells are essentially this container that holds all kinds of cytokines, including things like histamine. And estrogen has been shown to increase histamine production. We see a lot of estrogen-related conditions like endometriosis having high amount of mast cells and high amount of histamine. And this is sort of research that's been developing over the last few years. And so when we know there's more histamine, we can often see more bloating. And so because the estrogen can stimulate more histamine, it might be that way that it is causing more bloating. And so estrogen, as mentioned earlier, sort of like drives this histamine piece, and progesterone tends to comment. And so when we are seeing one hormone showing up more than the other because the other is declining first, we get more of this kind of histamine response. And histamine's been shown, we talked about it in our leaky gut episode, in our disorders of gut-brain interaction, about having increase in visceral sensitivity. So just like the awareness of how things feel inside the abdominal region. Also, increasing gut permeability, so that kind of leaky gut idea, and then triggering smooth muscle contractions. And so when everything starts to like get fired up, then we might see, like, aside from bloating, we might see more flushing, we might see more anxiety or jitteriness. So we often see women in this age category coming in and feeling more anxious or more heart palpitations. It's one of the reasons why often medical community will offer people anti-anxiety or antidepressant medications, because they're trying to calm some of the symptoms down, not really recognizing where they're coming from. We might see more onset of headaches or new food reactions, because remember, everything's just like kind of overdriving in the system. And so this sort of mast cell activation patterns tends to overlap with estrogen. And so that's why you might be seeing some of the social media that talks about, you know, if you calm down histamine, maybe some of your perimenopause symptoms go away. And it might be if histamine is what's creating those perimenopause symptoms. You always want to check in before you experiment talk far too much or go down too many rabbit holes, but can be like a flag of things to think of. And then the fourth area that estrogen might be affecting the bloating is that actually recirculates in our gut. So it's called the estrobolome loop, which sounds crazy, but we know that our microbiome has all these components, and estrobolome is a piece of the microbiome. And what we know about estrogen is that it's sort of made, and then anything, including estrogen, toxins, cholesterol, mole toxicity that we don't need, our body sends out bile, and bile becomes this river that all of these toxins can flow on. And so when the toxins flow on them and they move easily and they come out through the stool and you're not constipated, then everything works smoothly. However, it's not always the case. And so if you are constipated or you don't make good bile or you've had a gallbladder surgery, which we're going to talk about in our next episode, then what happens is the estrogen gets back into circulation instead of being removed from the body. And so I always think about it as like your broken, your crappy estrogen, instead of being removed and your body getting a fresh start, it just gets recycled back in. Your body's like, hey, it's still here. We'll just like use that again. And so that is a piece of where we get more slowing, more inflammation. The more the estrogen is reabsorbed, the more it feeds into this like creating higher amounts of estrogen, which then creates this like bloating loop. And so one of the ways that often people will find that the bloating reduces, even though they don't understand why it's happening, is people will take fiber or have been directed to take fiber. And then they're like, oh, my bloating got so much better. Well, fiber's job is to reabsorb or help to absorb some of these toxins and things that are floating in the bile to prevent them from reabsorption. And so inadvertently, when people are using those types of tools, they may be actually preventing the recycling of this hormone, as well as other things that may lead to some decrease in bloating.
It's so fascinating when we can see like a digestive approach then overlap and see benefits with what's going on with somebody's hormones, and fiber is definitely one of them. I once had a patient where her only perimenopause symptom was hives on her head. And so we discussed like there's a pretty common supplement that's used to support perimenopause symptoms, and it was the only thing that helped. So it's interesting, right? When you have to see what symptoms look like and thinking outside the box. Another point we want to discuss more in detail is that estrogen can increase visceral sensitivity, like Dr. Christina had alluded to earlier. So estrogen, we know, heightens how strongly the brain perceives gut signals. And so even like normal amounts of gas or distension can feel more heightened. So we can see things like higher pain, as well as feeling like it's intolerable or even emotionally distressing. And this is why estrogen-driven bloating often comes with, people saying, I feel huge sensations, or body image distress, or even anxiety around meals. And the gut isn't necessarily producing more gas. It's just feeling it more or feeling significant shifts that somebody otherwise would not be feeling.
And we could feel that in our cycles too. Like especially if you have a regular cycle and you track it, you get to understand these points of estrogen kind of rising and falling. And typically it's only a couple of days that we're feeling this. Going into our next point of how this estrogen bloating will start to get worse or change as your body transitions into perimenopause. So in the earlier years, when we do have that cycle, estrogen is rising and falling predictably for the most part if our periods are regular. And then that progesterone is going to balance it. So slow rise in the early phase of the cycle, and then progesterone rise in that second phase of the cycle. So as you transition into perimenopause, when everything becomes a roller coaster and very unpredictable, estrogen spikes can be higher than before, and that progesterone buffering ability becomes weaker. So the timing becomes unpredictable, and we kind of start to feel things more, or it's more confusing. So this bloating becomes less cyclical, maybe lasting more than just a couple days or a few days leading up to your period. It's more reactive. It can be more painful, or sharper, or kind of however people describe it in their body. Harder to determine what's going on with your diet. So harder to outsmart it with food, harder to take fibers and understand, what used to work for your gut doesn't really work anymore. And this is why a lot of people will come to us or start to talk with their friends how everything I used to do stopped working, and they're not wrong. Things are confusing, things are changing, and your body's trying to send different messages.
So estrogen is one reason why we might see more bloating in perimenopause. And just to kind of put this all together again for you, it's bloating that's worse later in the afternoon or evening. Symptoms worse around ovulation or erratic cycles, meaning when your cycle becomes shortened or lengthened. Bloating that might be accompanied with things like breast tenderness or headache. So really accentuated perimenopause symptoms. Maybe have some histamine symptoms. So go back to our mast cell episode and learn about those. And bloating that's maybe slightly improves with bowel movements or bowel activity. But it's not the only reason why we might be getting a hormonal change that is driving bloating. So next we're going to talk about progesterone.
Okay, so we've mentioned a couple times how progesterone has that buffering ability on that estrogen and what we're feeling in our gut. So point number 2 that we want to talk about is that progesterone loss is that less anti-inflammatory buffering. So typically the hormone progesterone is our chill hormone. So it's calming, relaxes smooth muscle, and it dampens that inflammation and that visceral or hypersensitivity that we're feeling. So when it drops, the gut's going to become more reactive, maybe tighter, just noisier. You're going to feel things more. So this is how progesterone influences the bloating and why as it declines, it's going to matter and you're going to feel it. So progesterone is your gut's relaxation hormone. It helps, and it does this by relaxing the smooth muscles, including the muscles of the digestive tract. So as food and fluids and foods and gases move through, you're going to feel it less. So it can accommodate more. So typically when our progesterone is adequate, the gut can do its job without us feeling everything down there. It's going to contract in a more coordinated, rhythmic way. So we know that it kind of pushes fluids and foods through. The gases will move forward instead of getting trapped. And the abdomen will stay softer, less reactive, more uncomfortable. And then as our progesterone drops, which often happens first in the perimenopause transition, and then we see more of those estrogen spikes. So this motility of the gut becomes less coordinated. The gut can spasm or stall. So a lot of our listeners and our patients have felt this for sure, right? That it just feels more achy or sharp in weird places. And then gases and things can get stuck. So bloating, pressure, distension, so that physical expansion of our gut, that's why we feel 6 months pregnant after dinner or as a day goes on. So this is why a lot of people will say, I'm not constipated, I'm having bowel movements, but I feel full and tight. So this is a movement or motility pattern of the digestive tract, not a fiber issue.
Progesterone is so fascinating, I find, because, as it relates to pregnancy, it can lead to constipation, but I also have many cases where it can actually help IBS. And there seems to be that relaxation component that we talked about, which can help with promoting more regular bowel movements. So progesterone's a super cool hormone. On that topic, so progesterone counterbalances estrogen's bloating effects. I mean, we want to think about progesterone and estrogen being happy together. You've got the yin to the yang. So estrogen, we know, tends to increase fluid retention, slow gut transit, and stimulate mast cells. But progesterone, on the other hand, normally acts like the brake pedal. And so in perimenopause, estrogen can spike unpredictably while progesterone stays low. And then we can see this, we'll call it a bit of an imbalance. And that then creates like a relative estrogen dominance, even if estrogen labs are normal. And of course, normal is like a stretch, right? Like the reference range for estrogen is massive. And so we're going to see more water retention, more visceral sensitivity, and more bloating with the same meals. Not because estrogen is bad, but because progesterone isn't buffering it like it previously did.
And this is why sometimes when women support with additional progesterone, things just seem to get better. And that is actually true in the case of mast cells and progesterone too. So progesterone is the mast cell calming effect. So sometimes people will say, even with normal cycling, that as they get closer to their menstrual cycle, they get headaches, they get migraines, they get more bloating, they get uncomfortable, they might not sleep very well, they might get more hives. And some of that is the histamine connection. And so because the progesterone has gone from sort of keeping the estrogen in balance to this drop or decline to initiate the menstrual cycle, then all of a sudden we're getting more of these symptoms that were probably always there, but just being held in place by having enough progesterone. And so that's sort of like flushing, anxiety, palpitations, food sensitivities, or even having more reactions. And so keep in mind that it's not always just that the estrogen is pumping out the histamine, it's that progesterone, which hadn't been keeping things in balance until this point, declines. And that may be tolerable for 2 or 3 days before menstrual bleed. But what happens when it happens for, 2 or 3 weeks or weeks to months? That's where we have to think about, are there other ways that we can help someone?
We know progesterone also affects bile flow and digestion in the way that it supports gallbladder emptying, fat digestion, coordinated digestive signaling. And so low progesterone can mean several things. It can result in fat feels heavier, meals can feel like they're sitting longer, and upper abdominal bloating or pressure. So people often blame gallbladder or food intolerance, but the issue itself is more of like an upstream hormonal signaling and then that affecting things further down.
Okay, so why bloating often improves in the luteal phase until it doesn't? So that second half of our cycle after ovulation. So earlier in the reproductive years when we have that cycle, that progesterone is going to rise after we ovulate. Bloating often improves mid-luteal phase. So kind of like a couple weeks before your period, there's that relief, like everything feels calm, your mood is good, you feel a little bit chill. And then in perimenopause, this ovulation becomes more inconsistent. So we're not getting that pretty typical, predictable cycle. The progesterone peaks are weaker or not happening at all. So estrogen's kind of left out there alone to make you feel more water retention, more aware of your symptoms, and just more bloated. So that relief window disappears and bloating can become more chronic instead of cyclical. So that's a big clue. So always good to track your gut symptoms with your cycle, especially when things start to change.
So far we've covered perimenopause and estrogen's role in bloating, progesterone's role in bloating. And so then the third area is mast cells. So we know that mast cell type symptoms definitely are affected by estrogen, and we know that they're affected by progesterone. But we also know that when we're seeing more lowered histamine intolerance, this might be something that's been underlying for a long time, especially women that have endometriosis or adenomyosis or fibroids. We know that that histamine piece has probably been playing a pretty significant role for a long time. And so it's almost like it exposes this mast cell piece that may have always been underlying, but has become more pronounced. It's like you have always had sort of an underlying anxiety or trust issue or something that's going on in your life, and then you have an event that happens that just blows that up. It's that it doesn't come out of nowhere. It's like always been a little bit underlying. So think about it in that way, like maybe it's not that this is a new symptom for you, but now it just becomes really recognizable because of some of the other changes that are happening. So that's sort of area 3. Area 4 is sort of this gut, ovarian, immune system loop. And so this sort of all starts to play together. We know that inflammation increases in the gut, especially when the estrogen recycling and the microbiome and all of those pieces are flowing. And so all of the reasons that we've talked to today for bloating is also accentuated when we have more inflammation. And so higher estrogen equals higher mast cells equals higher inflammation. And so then we're now seeing the immune system being triggered in to support the inflammation. And so we now start getting this like loop where things aren't really making anything better. And so you've tried all the gut symptoms, you've tried all the bloating supplements, you've gone to see a bunch of clinicians, and things aren't really getting better. It might be because of the hormones kind of triggering this loop that you're stuck in. Between the gut, the ovaries, and the immune system.
But on that topic of things not necessarily getting better, is that bloating we know is not always benign. And this is definitely the part that we don't want to skip. So, while most perimenopausal bloating is functional and hormonal driven, there's the element that it could be persistent or progressive. And that absolutely deserves, respect and further workup. And so things we want to think about is this bloating new and worsening? Is it unrelated to meals? Is it associated with pelvic pressure? Is it accompanied by early satiety or appetite loss? And all of those things could mean red flags, and certainly, discussing with provider whether a transvaginal ultrasound or an abdominal pelvic ultrasound is indicated would be important.
Yeah, we want to be clear about this, and this is really important. This is our role as our naturopathic doctors to our patients, but also your medical care doctor. And sometimes bloating is talked about on social media. It's like, just histamine related or food related or fiber related, and for sure. But we always want to reiterate that it is very important to talk to your doctor when things are different or lasting for a long time, because the gut is so complex and there's so many hormones and things acting on it, but also it's a structural component too, right? So what's around that area? So some things to keep in mind, daily bloating that's lasting weeks to months, and you're not really seeing a pattern here. You haven't changed your diet, you weren't sick, you've listened to these other episodes and it's not really resonating with you. But anything that's lasting weeks to months, you should talk to your doctor. Abdominal distension, so that's that firm expansion that you feel at the end of the day, your pants get tighter. If this isn't fluctuating, if it's there when you wake up, it's there at the end of the day, or maybe it gets a bit worse, that's something to bring up as well. If you feel full very quickly after eating or after a smaller meal or something that you would typically eat, if you feel any lower back pelvic pressure, that's something to bring up too. Unexplained weight loss, changes to bowel or bladder habits. So all of a sudden you're getting up in the night to pee, or you feel like you need to pee, but you can't fully empty it. More looser stools or constipation, anything that's just different. Especially if you have a family history of any ovarian or breast cancer. Ovarian cancer is very rare, but it's often missed because it can be very vague. It can present like bloating. And so the symptoms are very gut-like. So Dr. Dominique just brought up the pelvic floor ultrasound. So any imaging or gynecologic evaluation is helpful just to see the area, kind of rule things out and investigate these things. Because bloating doesn't behave like digestion, deserves a little bit more investigation.
I would say I have two patients that had like sort of irregular iron that just didn't respond to things, kind of this chronic bloating, and then hadn't been sent for a pelvic ultrasound. And when I counseled, like, yeah, you really should ask your doctor about that. Both of them had grapefruit size fibroids and ended up having to have hysterectomies because it was just so large. But neither of them, both were pretty young, and neither of them thought anything about it because they'd had babies. And so like, oh, they would have seen that. They would have known that. So certainly it can be important, especially if you're in perimenopause and maybe have had 8 or 9 months of not bleeding and then suddenly get some bleeding. That may also be another thing that instigates that alongside all the bloating symptoms. So better to have more uncomfortable pelvic ultrasounds than not know. Okay, some practical takeaways. So as everyone sort of emphasized, tracking the timing when bloating shows up during your cycle, even if your cycle is very erratic, kind of timing it not about the days, but, it was before bleeding or once I bled. Is it related to sleep or stress or hormonal shifts? So you're only seeing at certain times of the month. Making sure that you're doing all the things that help support motility, because this is a time in your life when motility is going to be constantly changing. And so the things that you've always done, the breathing, the poop stools, the walking after meals, the meal spacing, all the supplements and medications that have been recommended by some of your providers are all things, especially that help motility, that can be really important to not forget about. Lowering histamine load, if you're finding that some of those symptoms overlap, and sometimes that means higher histamine foods or beverages. So we definitely know wine, for instance, can be a big trigger here. And it's not always, it's a forever situation. It might be sort of, you might start to see in the tracking, if I also have wine when I'm right before my menstrual cycle, then I get a migraine and things become much worse and my bloating becomes much worse. So it's worth kind of starting to track. And initially you may think that there's nothing in there, but it's always helpful to bring it to your provider because they might be looking for something different. And so being able to kind of talk about how you feel or what you're noticing or how often you're urinating, all those things that we talked about so far can be really helpful. So how do you talk to your practitioner about this? Because it's like everything else. If we just say, I'm feeling bloated, you're probably going to get a very generic response. But if we can give the provider that we're seeing more information, then hopefully that will get us a little further down the road. And so, saying my bloating has only worsened since my cycle started changing. Could my hormones be affecting my gut motility? We know that the traditional medical system is pretty reluctant to measure hormones. Some of that is just providers don't have a lot of education about hormonal changes. And so you just getting a hormone test and randomly going on a date may not help them with any information because, as Dr. Dominique alluded to, the range is really big. And so they're going to say, you look normal. But normal is very varied. And so definitely if you're not getting anywhere with your primary care provider, seeking someone who does know a lot about both gut health and hormones can be really helpful. You may also notice that you're getting some of that flushing and anxiety after meals. And you might ask about, is histamine or mast cells a bit involved in this bloating that seems to also be coming alongside my hormonal changes? Another area where, we're starting to get more information into the mainstream media, but lots of times they still look at you like you have two heads. It doesn't mean that you can't ask, because your providers are also not going to learn about these things unless people keep asking. If my bloating is super persistent, it doesn't seem to be meal related. Maybe you're having some of those symptoms that Dr. Whitney talked about, like having sort of this like hard belly that doesn't seem to be moving, or getting some irregular bleeding, or having a history of hormonal cancers in your family. It's always good to ask, can we rule out any pelvic causes and not GI ones? And so those are really important things. You have to often advocate for your own health because someone else isn't always going to come up with all those ideas. But it's important, and that's what we're hoping this and all of our other podcasts teach you about, is how can you advocate for yourself and become more informed, and hopefully your providers become more informed and able to help you.
So thank you so much for listening to another episode with Team Gut Girls. This is a great topic because I'm sure as you're listening, you're like, yeah, that makes sense. I've noticed that change. It all started when my cycle started to change, or started to notice these other symptoms. So some main things we talked about were perimenopause changes digestion dramatically. Estrogen and progesterone shape the motility or the movement of the intestine. inflammation and histamine in your gut.
MCAS type symptoms can emerge during hormone transitions, but we know persistent bloating deserves investigation, not dismissal, because better gut health changes everything.
Thank you for joining Team Gut Girls. Like, follow, subscribe, and share our podcast with friends you think will want to know more about their gut. You can also visit us at teamgutgirls.com for show transcripts and more information, because better gut health changes everything. See you next time.